Here's a case from the implant department that we don't see every day, and I thought I'd pointed out one of the interesting services that we're able to provide. You can see these two implants are in close proximity to each other, and the dentist called us or sent this in because she wasn't able to fit both of the impression copings at the same time, I should say. So there was no way for her to get both of these into place. They would not fit simultaneously. So she put it on the second bite and took one impression, and then put it on the first bite and took another impression. And it's kind of hard for us to work like that, even whether it's teeth or implants. We'll see dentists who have multiple preparations on teeth, maybe 4 teeth that are prepped along here, and one of them's missed in the first impression. So they'll take a second impression and it's picked up there, and they'll say use tooth number 10, 11, 12 from impression number 1, and use 13 and 14 from impression number 2. And it's far from ideal when we have to do that, but with the precision of implants, it becomes even more risky when we do that. So there was no way for her to fit both of these in at the same time. So there's really only 2 solutions for a conundrum like this. One would be to take the impression coping and prep it. Actually, take both of them and prep it down. So to take a burr and start prepping the titanium down along here, the thick part, it's this part, the fatter part where it wasn't able to fit. But it's kind of tough to do as you go in with a burr. It's not easy to cut titanium like that and to make sure it's going to be flat enough so that these will both fit at the same time. And then a lot of dentists worry about the accuracy of the impression coping as well if they get rid of some of the indexing features. And so it's kind of a dicey thing to do. So what we were able to do for her, because we actually make our own implants, and of course we do custom abutments, is we were able to mill her 2 custom impression copings. And you can't see them now because they're in here. So they're titanium custom impression copings where they were designed to fit within these parameters between the cuspid and the first molar, and designed so that there would be room for both of those to fit simultaneously. So we were able to actually mill 2 custom impression copings for her, so she could, and she used an open tray technique, and she was able to place both of these in at the same time, verify that they were completely seated, and then take an impression. So now we have both these units in the same impression, and we're not having to move back and forth between the 2 and guess. And what we end up with is a nice model now where on the same impression we've got these 2 implants, the 2 implant analogs, and we're going to go ahead now and mill custom abutments for these, and then make a 2-unit, 2 splinted crowns actually. I was going to say a 2-unit bridge. But really 2 splinted crowns are going to go on top of these implants, and with the custom abutments we'll be able to get nice draw with this without playing any guessing games, which is nice. So if you find yourself in a situation like this where you've got 2 implants that are really close to each other and you don't feel like you want to go at a titanium impression coping with your 556 burr or with a diamond or something like that, know that there is the availability of us being able to mill 2 custom impression copings for you, or however many you might need. I think the fee for that is, I think it's $75 per coping, but they're both going to fit. You're going to get a great impression of them both, or 3, however many they happen to be, and that you're going to get a nice model from it. We're going to be able to make a nice set of custom abutments and subsequent crowns that have a very good chance of fitting once the impression's taken like this. It's a nice looking case. Actually, really my only complaint is I'm not a huge fan of wax bites. We have enough teeth here though where we're going to be able to hand articulate this nevertheless, so a wax bite isn't all that dangerous in a case like this. But the wax just is it's always pretty flexible, and if it comes from the other side of the country like this case did, there's always a chance that it gets too hot and distorts, or other things land on it and starts to distort. So not a big fan of this. Definitely like either polyvinyl bite registration materials or bisacryl bite registration materials like Luxabite are much harder, can't distort, and do not bend like the wax does. Regardless, we've got a nice bite here because of all the unprepared teeth that are in articulation, so we know that the mounting is good. And because of the use of a couple of custom impression copings, we now have everything on the same model and can design some custom abutments and 2 splitted crowns that should fit this patient very well.